Listen up. Are your erections feeling soft, unreliable, or just plain disappointing? If your performance is flagging, the problem is most likely poor blood flow, the essential fuel for a powerful erection. Let's cut straight to the core issue. Erections are a purely hydraulic event. To achieve a powerful, rock-hard erection, you need a massive, unimpeded rush of oxygen-rich blood into the spongy tissues of the penis, followed by the vessels briefly trapping that blood. If your circulation is compromised, your erections will fail. This isn't just a sexual health problem. Poor blood circulation is a major systemic issue affecting over half of men over 30, often manifesting as cold hands and feet, unexplained fatigue, memory issues, and, critically, lowered libido and erectile dysfunction. Fixing your circulation doesn't just benefit your sex life, it improves your heart health, fitness, and longevity. These 5 supplements are clinically proven not only to improve blood flow, but also to actively strengthen your arteries and blood vessels. I'm Dr. Katrina, your urology and men's health expert from Men's Health Channel, and today I'm revealing the top 5 science-backed supplements proven to skyrocket blood circulation to the penis. This isn't guesswork. This is the Nitric Oxide Secret used in clinical settings to achieve stronger, harder, and longer-lasting erections. Whether you're actively battling erectile dysfunction, ED, or just looking to take your performance from good to great, these 5 compounds are non-negotiable. Pay close attention because the #1 supplement is a game changer and the closest natural alternative to Viagra you can get. The supplement at number 5 is Carnitine, a potent amino acid derivative. Carnitine's primary job is helping your body produce energy by assisting in the conversion of fat into fuel. This surge in available energy translates directly into improved physical and sexual performance. But for erectile function, we focus on specific forms: propionyl L-carnitine, PLC, and L-carnitine fumarate. Propionyl L-carnitine is a circulation hero because it has been shown to enhance blood flow by actively promoting the production of nitric oxide, NO. Remember, nitric oxide is the key molecule that tells your blood vessels to relax and dilate, vasodilation, which is essential for flooding the penis with blood. Studies have demonstrated that PLC, especially when combined with other NO boosters, significantly improves erectile function in men with mild to moderate ED. It is particularly effective when poor blood flow is the primary cause of ED. Furthermore, clinical trials found that carnitine actually improves the efficacy of PDE5 inhibitor treatments, like Viagra, in men who are not getting the desired effect from medication alone. Action: converts fat to energy. Propionyl L-carnitine boosts nitric oxide for vasodilation. Dosage hack: start with 500 to 1,000 milligrams per day. For maximum blood flow benefits, it's best taken in combination with other supplements lower on this list. Coming in at number 4 is Panax Ginseng, also known as Asian ginseng, an adaptogen used for centuries in traditional medicine to enhance energy, libido, and sexual function. This powerful herb works on multiple levels. It is believed to improve blood circulation throughout the entire body, ensuring robust blood flow to the genital area. Research suggests that Panax ginseng directly helps alleviate ED symptoms by stimulating nitric oxide production and enhancing the necessary smooth muscle relaxation within the penile tissue, making it easier for blood to rush in. Beyond sexual health, ginseng is widely used to improve psychological function, exercise performance, and immune response. However, a critical safety warning: because of its powerful effects, ginseng may not be suitable for long-term continuous use. Some experts recommend cycling it, using it for a few weeks, then taking a break, to maintain effectiveness and avoid side effects. Men with high blood pressure must only take Panax ginseng products under direct medical supervision. Intriguingly, some studies also found that regular intake of red ginseng specifically helped decrease premature ejaculation and significantly improved overall sexual performance metrics. Action: adaptogen, stimulates nitric oxide and enhances smooth muscle relaxation. Safety note: cycle use. Avoid with high blood pressure without a doctor's guidance. Don't let the name fool you. At number 3, Horny goatweed is a legitimate traditional Chinese herb, and its mechanism is shockingly similar to pharmaceutical ED drugs. The active compound is a carrion, and it performs two key actions. First, it helps increase nitric oxide levels in the body, promoting vasodilation. Second, and most importantly, a carrion acts as a natural PDE5 inhibitor. The enzyme phosphodiesterase type 5, PDE5, is the bodily mechanism that normally breaks down nitric oxide, causing an erection to fade. By inhibiting PDE5, horny goatweed helps to maintain higher nitric oxide levels, which supports better, stronger, and longer-lasting erections. This dual action of NO production and PDE5 inhibition makes it powerfully effective. Some studies also suggest a mild, beneficial effect on boosting testosterone levels, further enhancing drive and energy. When shopping, always look for supplements standardized to contain 10% to 60% a carrion. Action: boosts NO, inhibits PDE5, similar to Viagra, for sustained rigidity. Dosage hack: for daily support, use 250 to 500 milligrams. For active ED treatment, 500 to 1,000 milligrams per day, but cycle use, 4 to 6 weeks on, 1 to 2 weeks off, to prevent tolerance. Avoid if you have severe heart issues or are on blood-thinning medication. L-Arginine is a foundational supplement at number 2, a widely known amino acid that plays a crucial role in improving blood flow by being the direct precursor to nitric oxide, NO. The body uses L-Arginine to manufacture that key vasodilation molecule. Many scientific studies have repeatedly shown that men struggling with ED, particularly those with milder forms, often have measurably lower levels of endogenous nitric oxide. L-Arginine supplementation reliably helps correct this deficiency, thereby improving erectile function. Because L-Arginine supports blood vessel flexibility and helps lower blood pressure, it's also a powerful supplement for overall cardiovascular health, which is directly linked to better erections. Here's the combination secret. L-Arginine is highly synergistic and is best taken in combination with other supplements, like propional L-Carnitine, for enhanced NO production, and even horny goatweed, to stack the effects and achieve a more potent result. Action: direct precursor to nitric oxide, improves blood vessel flexibility. Dosage hack: ranges from 2,000 to 5,000 milligrams per day, ideally divided into 2 or 3 doses. Critical tip: take it on an empty stomach 30 to 60 minutes before meals or activity to significantly maximize absorption. Here is the number 1 non-negotiable supplement for achieving rock-hard erections: L-Citrulline. L-Citrulline is a naturally occurring amino acid that is the true superstar because it is more effective and efficient than arginine. When ingested, L-Citrulline is converted into L-Arginine in the kidneys, and this L-Arginine then immediately goes to work boosting nitric oxide levels. Notice the pattern? All 5 supplements converge on nitric oxide. L-Citrulline earns the top spot for 3 main reasons. Superior absorption: L-Citrulline is significantly better absorbed by the body than L-Arginine, meaning more of the dose actually reaches the bloodstream to do its job. Sustained NO levels: it provides a longer-lasting, more sustained increase in nitric oxide levels compared to the relatively shorter boost from L-Arginine. Fewer side effects: it is generally better tolerated with fewer gastrointestinal side effects, which can sometimes plague high doses of arginine. Studies consistently show that L-Citrulline supplementation significantly improves erectile hardness in men with mild to moderate ED. Because of its superior mechanism and effect, it is considered the best natural alternate to prescription PDE5 inhibitors for improving erectile function and overall cardiovascular health. Action: converts to arginine, providing a long-lasting, highly absorbed boost of nitric oxide. Dosage hack: common dosage is 1,500 to 3,000 milligrams per day. Like arginine, take it on an empty stomach 30 to 60 minutes before sexual activity to maximize peak benefits. These 5 supplements, L-Citrulline, L-Arginine, horny goatweed, Panax ginseng, and Carnitine, form the ultimate arsenal against poor blood flow, but they are most effective when stacked intelligently and combined with a healthy lifestyle. The ultimate stack strategy: to maximize your nitric oxide, NO, production and maintenance, combine the two most effective agents, L-Citrulline, for sustained NO production via superior absorption, and Horny goat weed, for inhibiting PDE5, thereby preventing the NO from being broken down. Adding propional L-Carnitine to this stack is the final optimization, as it enhances blood flow delivery and provides cellular energy. This synergistic approach creates a multi-layered attack on the vascular causes of ED. Remember, you are targeting a vascular problem, and vascularity requires systemic support. The non-negotiable lifestyle foundation. Supplements are not magic pills. They're amplifiers for a healthy foundation. They work best when your lifestyle is optimized. Diet. Focus on foods rich in nitrates, like beets, leafy greens, and dark chocolate that naturally contribute to NO production. Cut out processed foods and excessive sugars that damage blood vessel lining, endothelium. Exercise. Cardiovascular exercise is your most potent medicine. Running, swimming, or brisk walking for 30 minutes daily strengthens your heart and keeps your blood vessels elastic, which is non-negotiable for quality erections. Pelvic floor. Simple Kegel exercises strengthen the pelvic floor muscles, bulbospongiosis and ischiocavernosus, that help trap blood in the penis, directly improving erection rigidity and stamina. Stress management. Chronic stress spikes cortisol, which actively shuts down arousal pathways. Meditation, sleep, and managing stress are crucial for optimal sexual function. Erectile dysfunction is often the canary in the coal mine, signaling deeper vascular health issues. These supplements offer a powerful, evidence-based pathway to not only restoring your performance, but also to proactively improving your cardiovascular health, energy, and overall longevity. Don't wait for your performance to hit rock bottom. Take control of your NO levels today with this blueprint. Disclaimer: the information provided in this video is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or health objectives. Never disregard professional medical advice or delay in seeking it because of something you have watched or read here. Reliance on any information provided by this video or the channel is solely at your own risk. Before starting any new diet, supplement regimen, exercise program, or making any changes to your current medical treatment, you must consult with a healthcare professional.